Hello, I'm Danielle Vonfeld at the Hayes Medical Center in Hayes, Kansas. I want to visit with you about your loop recorder insertion. The cardiac loop recorder is a device that continuously records your heart rhythm. It is also called an insertable cardiac monitor or an implantable loop recorder. It is a small device about the size of a small USB memory stick. It is implanted in your left chest area just under the skin. The device records patterns of your heart's rhythm called an EKG. Insertion or removal of the recorder is done under local anesthetic and takes approximately 15 to 20 minutes. No general anesthesia or sedation will be used during this procedure. The insertable loop recorder is used for patients who have occasional symptoms of fainting, lightheadedness, weakness, or abnormal heart rhythms. The recorder can be left up to 3 years. When a symptomatic episode occurs, a pager-sized activator is placed over the recorder site and a button is pressed to activate the record. After insertion or removal, you will either have one suture or an adhesive glue called Dermabond with steri strips. The Dermabond adhesive will slough off with the steri strips. Please do not pull the steri strips off. Keep your incision clean and dry. You may remove the bandage and shower after 48 hours. Do not scrub the site. Carefully wash your site with soap and water and pat site dry. Keep the area clean and dry until it is completely healed. Most people can return to normal activities soon after the procedure. You will receive a device identification card after the implant. Carry the device identification card at all times. The identification card will need to be presented if you were to have an MRI or go through a metal detector at an airport. Every night at midnight, the home monitor device will search for you and download the information for the day. If you miss a day, the monitor will download the next midnight. If you will be out of town for more than a night, then your monitor device should be taken with you. This monitoring device will continuously download EKG throughout the day. Your loop recorder will come with a clicker remote. If you have symptoms like syncope, dizziness, or irregular heartbeat, hold the remote up to your chest and press and hold the button until you hear it chirp. A light will go from blue to green. This will check mark that moment on your heart EKG and tell the monitoring facility to go back to that specific time to look at your EKG. We will review this with you before your discharge. Follow up with your cardiologist as directed. If you have a suture, you will return for a follow-up appointment in 1 week for a suture removal and site check. Contact your cardiologist if you feel weak, dizzy, faint, or if you have a fever, chills, or if the site is red, swollen, or draining pus. Also notify the cardiologist if you observe the loop device protruding from the procedure site. Continue to take your prescribed medication as ordered unless directed by the cardiologist otherwise. If you have questions or concerns about your loop insertion or removal site, if your condition worsens, please contact your healthcare provider. Please call the cardiology clinic at 785-625-4699.